Hi everyone. So today we are going to talk about nursing student to CRNA and some steps you can take to help you along your journey. So many of you have found this community early on, which I'm very grateful and thankful you have. I do understand this. If you look at the journey as a whole big picture, it can feel very overwhelming. And also I feel like as a nursing student, sometimes you don't always get the best advice from your peers because they're also facing the doubts, the fears, the overwhelm with the journey. So it's really best to kind of start your journey as a nursing student with an open mind and just success. You have to visualize success. If you go into it thinking, well, I can't do that, I'm not smart enough, or so-and-so says this or says that, then that's the reality that's going to unfold for you. So I encourage you to kind of start this journey with a positive mindset, take it day by day, month by month, and trust me, if you do that, you will stay the path and become a CRNA. So let's go ahead and dive into it some more. All right, first I wanted to point out, and I'm going to go ahead and post it in the comments up here. I think I can anyways. Maybe I can't. Well, I will post it in the comments when I am done with this. I thought I could put it live in the comments, but it doesn't look like I can from this streaming platform. But I have made an 8-step CRNA roadmap. I made this with you in mind. It's 21 pages. It's more than I can cover today in this video. So I really encourage you to download this resource. It really walks you through 8 steps. And I tried to simplify it, but also hit some of the big hitters along the way that I find a lot of students get stuck around. So again, 8-step CRNA roadmap. I will make sure the link to get this download is posted in the notes or in the comment section below. So that's the number one thing I want you to do today is to get that resource. So first I wanted to kind of touch on the fact that, to go into CRNA school, you do need your bachelor's or your BSN. However, there are other avenues to get that. You can start as an LPN, get your ADN, and then your BSN. You can even, some schools take an ADN plus a bachelor's in science. So again, you don't necessarily have to go the traditional nursing, 4-year nursing school route to accomplish CRNA. But you do need to avoid pass-fail programs. So any college that issues grades as either a pass or fail, those should be avoided. You need the letter grade. So that should be something that you look for when you are looking into where to get your bachelor's degree or ADN degree or LPN degree. So make sure, again, you stay away from programs that offer pass-fail grades. CRNA schools need to see a letter grade. They do calculate your science GPA, your overall GPA, and your last 60 credits. The emphasis or a lot of preference is placed on your science GPA. The reason why schools will always divvy up your science GPA is because the anesthesia curriculum is very, very heavily science-based. And so it's been a proven indicator to these programs, and they all look at the statistics of students who pass boards the first time. Typically, historically, students who tend to pass boards the first time also tend to be the students who have a higher science GPA. And when I say higher science GPA, the average is right around a 3.5. Now, it doesn't mean if you have less than that CRNA is not capable for you. However, if you know early on what your science GPA is going into, say, graduating nursing school, going to the ICU, it allows you that time to make up for it by retaking some science classes or working on graduate level science courses to really help bring your overall science GPA up. And when I say bring your science GPA up, if you have probably less than a 3.3, closer to 3.0 science GPA, and definitely if you have less than a 3.0, you need to be thinking about things you can do to boost your science GPA. So we're talking about nursing students here. So depending on where you're at in your nursing school program, the problem with science is, you guys, is it tends to be in that very first year of college, which is unfortunate because a lot of us don't really have a direction at that point. We're not serious. We don't know. We think, okay, we're going to nursing school. Cool. We're done. It's not really till later on in your nursing career that you potentially decide that you want to go back to grad school. And so sometimes when I see students, they weren't taking school seriously. They didn't perform well. And it's, unfortunately just something they have to deal with going forward. But I don't want you to fear this. It does mean that you're going to have a little bit more work to do, and essentially, if you have a lower science GPA, you're going to find more rejection than exception, meaning you're going to experience less interviews and potentially get waitlisted and maybe not interviewed at all if you have a lower science GPA. So it's really key that you take active steps towards bettering that, and also understanding that certain programs just may not be the right fit for you. Some programs are not very lenient, and some programs are more lenient. So it's really going to the open houses, touching base with the program director, and evaluating your unique situation. CRNA School Prep Academy does transcript reviews with program faculty. Uniquely, you need to have a program faculty look at your transcripts. They are well versed in this and they can best guide you. However, I will preference this that it's always best for you to go to your particular program of interest to have them take a look at your transcripts, but know that not all schools can do this for you. All schools are set up differently as far as their staffing and how much time they have to do things like this on the side for people who inquire about their program. So if you email to ask about your transcripts and you get crickets, know that it doesn't mean that they don't, like you or want to work with you or anything along those lines. It just means they just cannot respond to emails in that way. Again, from what I have discovered is some programs are staffed accordingly. So where the assistant program director, for example, can have several hours a week to spend helping students who are reaching out to the programs for this type of information. Some schools do not have it staffed that way, so they literally do not have time to do those extra things for people looking into their program. So, but it doesn't mean you shouldn't try. You should always try to have your transcripts reviewed by your actual program. If you do not get any help in that realm, I encourage you to come to CRNA School Prep Academy and have one of our faculty members review your transcripts. They can't tell you real specific courses, but they can guide you on where you best should put your time. I see so many students take courses that are unnecessary, which we're going to touch on here in a minute. So again, focusing on your core sciences, that is chemistry, biology, anatomy, pathophysiology, whether it's separate or combined, any math courses like algebra, stats, all of that plays into your science GPA. All right, so let's talk about grades. We kind of just started going into that. I got a little ahead of myself, but grades do matter. I hear so much, and I even hear it from people who are mentors to other people in the nursing realm that, C's get degrees. If you've ever heard that, it goes in the garbage, okay? That's a negative fixed mindset belief. If you're willing to accept C's, you're limiting your potential. And don't get me wrong, I've gotten C's, I've gotten D's, I've flunked, in grade school I flunked a grade. Anyways, I've struggled academically. I understand that school can be really challenging. I'm not saying C's mean you're a failure. That is not all what I'm trying to say by this. However, C's do mean that something is not working. Something needs to change. Your strategy, your technique, your understanding has to improve. And why is that? I encourage you that if you are a C student, you need to figure out why. You need to ask yourself, well, what can I do differently? Clearly what I'm doing means I'm not grasping the concept, and why is that? There will always be a reason, and it's not always easy to find. I promise you, it is there. You are smart. You are capable. You are capable of getting more than a C. I know you are. Do not accept it and try different strategies to improve. And so the whole saying C's get degrees, I'm not sure whoever came up with that, but I highly dislike that. Because if you accept it, well, you're going to limit your future. And, the earlier you adapt, that's not the right way to think, the better off you're going to be long term. I'm a mom. I have 3 kids. And if they ever say that to me, they're going to get a mouthful back. So I hope I never hear it from my own children, but I am ready. I'm ready for the day that I do hear that from them, because I'm going to make sure that they know that that's just not the right mindset. We need to focus less on a fixed mindset and more on a growth mindset. Growth mindset embraces it's okay to get a C, but how can I change? How can I change my strategy? It doesn't mean that you are a certain way. Just because you've done a certain thing, accomplished a certain thing, does not define who you are. It's in the moment, in the present, and you have more life to live, more opportunities to take, and it's all about growth and change. And so if you focus on that, you don't feel so icky when you get a C. You should not feel icky when you get a C or a D or anything like that. You should just say, oh, well, how can I improve? What did I do? What can I do differently so I can grasp this better next time? And just move on from it. So again, grades are important. Most of the students I see struggle for a couple reasons routinely. And it's grades, or potentially interview. Those are two big ones, interview and grades. And trust me, 4.0s do not get into CRNA school. So let me also preference that, is that you don't, just because you're a 4.0 student does not mean CRNA school is a given. 100% it does not. The interview is very telling, you guys. And the reason why I'm bringing this up, and it wasn't even something I was going to touch on today, but they want to judge your character. They want to see, are you in a fixed or growth mindset? Do you display emotional intelligence? How well or how much self-awareness do you have? Do you understand who you are as a person and how you work with others? They assess this very intricately in the interview. And so it's up to you now, while you're a nursing student, to kind of assess where you stand. And trust me, we all have room to grow, including myself. And so again, it's not all about grades. Grades are only one piece of the puzzle. You know, your essay and your why. Why do you want to be a CRNA? You need to have more than just, I want to help people. And if that's what you are falling back on, you need to dig into this a little bit deeper and have a reason that makes your hair on your arm stand up. Okay, if you have a reason for CRNA that gives you goosebumps, that just makes your core tingle, that's your why. So usually it requires more effort than just the surface level. You need to go deep. You need to go deep into why. What is it about this career that you know will light you up every day when you go into work? And they're looking and they're assessing for these things. So again, grades are only one part of the picture. However, grades are very important. So again, if you have a 3.0 or even less than a 3.0, you're going to get more rejections than acceptances, and you need to know that prior to going in and not be willing to give up. You have to know that you're going to have to be persistent. You're going to have to keep trying. And if you haven't listened to my podcast episode with Mike, where he faced 12 rejections, he got in on his 13th try. If you listen to his stats, you guys, too, he didn't have a low GPA. He had good ICU experience. There was nothing really that really stood out as far as a big red flag in his application. However, there clearly was something missing. He went on a lot of interviews. So ding, ding, ding. It was probably his interview. It took him a lot of time to really come to terms with that and really work on ways to improve. I think he came to CSPA, CRNA School Prep Academy, during around his 6th or 7th interview, like when he was getting into his second year of applications. So I really encourage you, if you are struggling, please seek out help, get guidance, do a mock interview, do 3, do 4, do however many you need, get the feedback and work on improvement. If you go into the interviews doing the same thing over and over and over again, you're going to get the same results. That is the definition of insanity. So remember that. All right. So that is grades. Let's talk a little bit about extra courses, because again, I mentioned I see a lot of students make this mistake, and it's very costly and it's a very time-consuming and costly mistake. Like, for example, I had a student who took a research course and a grad or a chemistry course, for example. They ended up getting a B in chemistry and an A in research. Now, the only reason they went to take a research course and a chemistry course is because their chemistry, they had a C. That was the only C they had, and they were told that if it wasn't for that one C, they'd have a 3.8 science GPA. Meaning, I think their science GPA was right around a 3.3, okay? They got a B. A B is a 3.0. A B is a 3.0. Unless it's a B+, it's a 3.3. So that B didn't help, and if it was really a B, a 3.0, it actually hurt. Now, the research class was an A, okay, but that's not going to pull the weight like a science course will. You know, research essentially is almost a given A. I mean, if you do the work, you're going to get an A. It's not the kind of course that they know is as challenging as, say, a chemistry course, anatomy pathophysiology course. They know this. It's not going to pull the same weight as if you were to go get a chemistry A in a chemistry course, for example. So essentially, the reason why I'm pointing this out is because it's not easy, essentially, to, yes, they did do better. They had a C, now they got a B. Cool. But as far as overall GPA, at a science GPA to 3.3, you know, it barely budged any, if not actually, if a 3.0, after you had a 3.3, it probably brought it down, and the A maybe. So it pretty much stayed the same. So essentially, it didn't really help the overall GPA, and the science GPA might actually been hurt from that B, if I'm clarifying that correctly. So the overall science GPA, because of the research course, bumped the overall GPA, but that was not the issue. The issue was the science GPA, not the overall GPA. Overall GPA was like a 3.6 or something like that. So that was not the issue. It was the science GPA was a 3.3. So by taking the chemistry course and getting a B, now they probably have a 3.25. Okay, so it didn't help. And the reason why I'm pointing this out is because if in this person, I think, thought doing extra by doing an extra research course, it would only help. However, they just made themselves busier, because that's a busy course. That's a busy course. It's just busy work, right? Where chemistry is very hard and you have to be very focused. And they were also working full-time as a nurse. So I'm telling this just to stress the fact to slow down, do one thing at a time, get an A, is A minus. Just try your best to get an A. You really want to put all your focus and attention on the one science course to really bring your science GPA up. Don't try to take anything additional at a time. Focus on that one course, get an A. That's really what's going to help your science GPA. And remember, a straight up B is a 3.0. So a 3.0, if you have a 3.2, 3.3, it's actually going to bring it down. If you get a B plus, well, you're going to stay the same. So you need an A minus or an A at the minimum to actually bring your science GPA up. So just please keep that in mind before you enroll in extra courses. All right, let's get into ICU experience. You're a nursing student. So I wanted to bring this up now because there are some steps you can be doing as a nursing student to kind of get your foot in the door and to, help you get in straight into the ICU. I personally think that's the pathway to go versus trying to start anywhere else. However, don't think that starting on a step down or med surg means CRNA is not for you. It just means that you need to work towards getting to a step down in the ICU. There are plenty of people who go straight into the ICU as new grads, including myself and plenty of people in this community. So it is possible. It does not mean you're going to miss anything. You're going to be fine. You're going to be fine. In fact, you're going to be right where you need to be. Because all the skills that you need to learn for CRNA, you learn it in the ICU. Yes, there are some time management skills that come with med surg, and don't get me, I'm not downplaying that experience at all. However, the critical care thinking aspect of it is what you really, really hone in and focus on the ICU, which is what they're assessing in the interview. Don't get me wrong, time management is necessary, but they assess your critical care knowledge, which is where you spend your time building that, working on the ICU. So going straight to the ICU really is where you can really speed up your process getting into CRNA school. And to do that as a new grad, fresh out of nursing school, there are a few avenues or a few things you can be doing now to really help your odds of that happening. Best by far is to get experience working as a nurse's aide in the ICU. By far the best, and take it as a job interview, a long-term job interview. I mean, if you spend 1 or 2 years working as a nurse's aide or a CNA or whatever they call them these days, a student nurse assistant, SNA, you are essentially setting yourself up for an intern position, a residency position, a direct hire. Not too many hospitals these days do direct hires. However, that still happens. I know back when I made that transition back in 2009, they had just stopped doing direct hires, and I worked at a level 1 academic facility, a very large facility, and they made all fresh new grads go through a residency program to go straight to the ICU. They only took about 30 of us, and it was for the SICU, MICU, neuro ICU, and I forget some of the other placements. But so as you can tell, it was a small. I mean, we had my nursing school class was like, I don't know, 150. It was large. It was a large nursing school class. So 30 people, very, very competitive. And the ones who tended to get these spots were the ones who worked in the ICU as a nurse's aide, including myself. Back when I was in nursing school, granted, I never had anyone give me this advice. I simply wanted to go to the ICU as a nurse's aide because I knew if I wanted to go to CRNA school that I had to get ICU experience. I kind of wanted to see what I was in store for, if I'm being perfectly honest, because when I was a nurse's aide working in a step-down unit, I would occasionally float to open heart cardiac unit, and it terrified me because I'd see patients die. I'd see patients get their chest sawed open and massage their heart. I had a patient fall on me one time in code, trying to get him up out of the chair, back into the bed. He just fell on me and just eyes rolled back and laid him on the floor and coded him and just died. He was 35. Totally traumatized me at the time, and I was probably like 19 years old, or I don't know how old I was. I was young. I was still in nursing school, like I said. So I actually worked as a nurse's aide on a step-down unit, or like a peripheral vascular disease unit for a year before I made the decision to go to the MICU, because at that time I knew I was serious about CRNA school. And I wanted to do it because I was like, I don't know if I could do ICU nursing. After these experiences floating to the actual ICU, I was like, I don't know if I'm cut out for that, but I got to try because I know that that's what I need to do if I'm going to become a CRNA. So I went there as a nurse's aide thinking like, let's just see what these nurses do. Let's see how traumatizing this is so I can get it out of my system now and see if I can actually stick this out. So that's actually the reason why I did it. Little did I know that that was really how I was going to get my foot in the door as far as being hired. I mean, I had those nurses, they loved me. They were like my family. They took me under their wing. They mentored me. They essentially begged me to work there afterwards, which was, and I did. I worked there in the medical ICU for almost 3 years prior to going back to CRNA school, got glowing letters of recommendation because, again, not only did I work there for 3 years, I worked there almost for an entire year prior. So I had 4 years of experience with the nurse manager there. So it ended up being a very great experience, but it was a very difficult experience because I did not like the ICU. But that's a different story for a different day. But I did it. I put in my time, and ICU is a hard, there's no really way to sugarcoat it. Working in ICU is difficult. It's hard. It's depressing. If you're suffering through that right now, know that you need to utilize your resources to get help and support where you can. And just know that being a CRNA is not like that. It's not like that. I would never have survived. I had to do it to become a CRNA. Being a CRNA is not depressing. It's fun. It's rewarding. It's worth the time in the ICU, but the ICU part is brutal. However, other options for you other than working as a nurse's aide, which I think you should do regardless, honestly. I don't think you should skip that step, is to network on through the AACN as a nursing student, create your LinkedIn profile. The students who I see struggle to get straight into the ICU are the ones who typically don't work in the ICU prior to graduating. And there could be multiple reasons. Maybe they were making good money and the CNA was a pay cut. I mean, it's a pay cut, but it could get you the job you want, So, and our valedictorian in our class got a job at a nursing home after school because she never worked as a nurse's aide. She worked, I forget what she did. It was, I don't know. I forget what they even called those programs where you the study work programs where you essentially get paid to sit and study. I forget what it's called. But they never worked in the hospital setting prior to graduation. She was the 4.0 student, but she couldn't get hired. And I just remember thinking wow, our valedictorian from our nursing class couldn't get hired in a hospital. And it's because she had no nurse's aide experience, so it's a big deal. So I personally think that's something you should make a point to do. Okay. Leadership. Okay. This can start in nursing school. And if you were to ask me back when I was a nursing student, I would have been like, heck no, don't look at me. I want to hide. The idea of leadership was so scary to me. And here's my challenge to you. If this is you and this was me, ask yourself why. Why is it so scary? For me, I just didn't feel like I was smart enough to lead. I felt like I was the dumb kid. So why would I lead anything? I don't know it all. I thought if you led, you had to be the smartest and the best, right? It's not true. It's not true. And I do it now. Am I comfortable doing it? No, I don't like leading. It's scary, you guys. It's scary. I make mistakes. I say silly things, and sometimes when I listen to myself speak, I cringe. I don't even like listening to myself speak, but I still do it. And why? Because of you. I do it for you. I do it because you need it. I enjoy helping you. That's why I do it. Not because I like it. Not because, I still, like I said, the idea of putting myself out there in front of people, speaking up, it makes me uncomfortable. And so when I was a nursing student, I hid. I kept quiet. I didn't volunteer to do anything because I just didn't believe in myself to be able to do it. It really wasn't until I started mentoring you guys inside CRNA School Prep Academy and inside the Facebook group that I was literally like, Jenny, why am I hiding? I could be helping so many people and put my issues aside, address why I have these issues, and do your thing. Have a voice, be a voice. And even if you're not right, it's okay. You're human. They don't expect perfection. No one expects perfection. In fact, people appreciate non-perfection because it's more human, right? So I encourage you, if this is you and you're afraid to take a leadership position, whether you're still in nursing school, ask yourself why that is. And if it's because you're afraid of who you are, then you need to get down to the bottom of that. Because really, you have to really see yourself in a positive way. You have to stop beating yourself up. You have to love yourself. And it's much easier said than done. Knowing, again, I struggled with that and believing in who I was and thinking I was just this dumb person. And, but all that stuff, negative talk, you can change that. You can, when you start doing it, catch it. That's the first step with any of this, you guys, is being aware of what you're doing to yourself and catching it, becoming aware. Self-awareness is huge. If you become self-aware of your own thoughts every day, you can shape your your enjoyment, your day to however you want it to be. It's literally how you want it to be. It's one of those things where you see what you want, right? So if you decide you want a white Honda Accord, prior to that decision, you don't see those cars on the street, but then you buy one, you drive one, you're like, I love my white Honda Accord. And you're like, man, everyone else has a white Honda Accord. It's because you've trained your brain to see that. You want to be that. You want that car. So now you see it everywhere. So same thing with mindset. And you might not believe me. I promise you, just try it. If you look for the positive and find the gratitude, even in the bad situations, even when things don't go your way, if you try to bring yourself back to gratitude and look at some positive things that could possibly come out of this. Okay, that stinks that happened to me. That's a problem. But now I know. Now I can tackle that problem. Now I can address it. So that's how you bring gratitude into a bad situation, right? Versus just getting pissed and angry. Why did this happen? But it's not fair. Like, okay, this happened. I'm dealing with it. And now I'm aware of this problem. Now I can grow from this experience. And so adapting this kind of mindset turns into leadership because you help others do the same thing. And that's literally all I've done. I wouldn't say that I'm anything special, but I also know that I've focused on my own mindset so much that I now can help others do the same thing. And it's a work in progress. It's always a work in progress. You're never going to have it all figured out. So take the opportunities that come to you, look for leadership roles, and embrace them. Embrace them for what they are and make yourself uncomfortable. That's the only way you're going to know, and is if you do it. All right, and I think I preach this all the time, but I'm going to preach it again and over and over and over, is a shadow. And yes, it is extremely hard right now to get a shadow experience, which is why CRNA School Prep Academy made the virtual simulation experience for you guys. In that virtual simulation experience, Richard Wilson walks you through, preoperative assessment, induction, maintenance, emergence, and all the education that goes with it, on top of having 7 SRNAs in an anesthetist simulation lab record and walk through a general anesthetic. This is the closest thing that we can do for you, and schools are accepting this as a shadow experience. We've also had students who do this as simulation and tell us that, wow, Jenny, this really helped me for my real shadow experience. I knew exactly what to ask. I knew exactly what they were doing. I understood why they were doing things, and it really helped me be engaged for my actual shadow day. So I do highly encourage you, even if you have a shadow experience lined up, to do the virtual simulation experience to kind of help you be more engaged so you get more out of your real experience. I also have a free documentation form that I can put in the comments below as well. This is just like a documentation form, because even if I do encourage you first to look at, see if your school has their own form. If they do, print it out. But go to your school to see if they have their own shadow verification form and fill it out. If they don't, make your own. Submit it as additional documentation. You're never going to go wrong by documenting your experience, and here's why. Because where the magic happens, you guys, is in the reflection. It's not necessarily the experience, it's the reflection on the experience. So when you document your experience, you're reflecting on it. And it's the same thing with like learning, and you can sit through an entire lecture and be like, I don't know what I learned. But it's not until you sit down and reflect on what you listen to that the learning takes place. It's like your brain has to somehow soak it all in, and it only can soak up so much at one time. So it's the reflection is where the growth happens. So that's why I think it's important to document your shadow experience. I think it's important to get this experience early on while you're in nursing school. My first shadow experience came when I was in nursing school, and it was when I was in, they said, hey, anyone interested in spending a day in the OR to kind of see what it's like in the OR? And I was like, oh my gosh, me. And I probably hassled the clinical coordinator every day for a week straight until she's like, okay, you're going to get a spot. And I naturally, when I did it, I didn't even know, honestly, at that time, didn't know CRNA was what I was really going to pursue. But when I got to the OR, I gravitated towards the head of the bed. I was like, who's up there and what are they doing? And you're super cool. And then when I found out it was a nurse, I was like, oh, sign me up. This is awesome. And so then I kept getting more shadow experiences and solidifying my desire to become a CRNA. And many of you have mentioned in the group, but when you gain these shadow opportunities, it lights you up. It fuels your desire to pursue this career path, which is why I think also it's so valuable. It also allows you to understand it. So when you get in your interview and they say, why CRNA? Remember how I said it has to make your hair on your arms stand up? And if you have hairy arms like me, they'll stand up. But you have to know that why. And when you figure out that why, it's because you spent time researching this profession, talking to CRNAs, understanding the day in the life, and seeing it in action. And so that way, when you get into your clinical rotations, you're going to be excited about it and not like, oh my gosh, I didn't know you did all of it. I didn't know. I mean, granted, you're still going to probably learn things that you probably didn't know ahead of time. I know I did. I had no idea, honestly, that CRNAs did as much as they did until I actually, again, learned more by shadowing. Like I got to see them in multiple types of cases. But yeah, I mean, I just encourage you to get that experience because you want to go into school understanding exactly what you're going to get in your training, which is also why open houses are important too, to ask questions and talk to current students. We do quarterly SRNA Q&A panels. We just did one. We had a student from Case Western, North Dakota, and National University. I don't have the students lined up for the next one, but it's going to be April or March. I forget. I have it all listed on this calendar. Because my brain's just too much. But I think April or March, we're doing the next SRNA Q&A panel. And it's your chance to talk to current students, pick their brain, ask them questions about their school, what it's like being a student. And this, you guys, doing that is a huge benefit to you. It really allows you to kind of get some insider information and kind of see what you're in store for. So if you don't know current students, try to seek current students out to talk to as well. That was a little bonus for this episode. And of course, I need to let you guys know that we have CRNA School Prep Academy. We have designed this Prep Academy to help you along the journey. Even if you're in nursing school, we have a lot of information in the planning phase for you. And again, we help you figure out, again, why you want to pursue this career path, how you fit in this career path. Also, we look at, your grades and what courses you need to take that maybe you don't get. I know that some nursing schools don't really have you take a full-fledged chemistry course. So we kind of address these issues. We have opportunities for mock interviews. We do resume building workshops, ICU interview information in there. There's all kinds of stuff that's really going to help propel you towards success inside CRNA School Prep Academy. And so again, I encourage you, if you have not checked us out, I really encourage you to do that. I also want to let you know that your journey is unique. And I see a lot of nursing students compare themselves to other students who are also pursuing CRNA. And they're like, well, I don't have that 4.0, or I don't have the ICU experience yet, or I don't have all this. It's okay. It's okay. You're here, you're listening, you're showing up by being here listening. That's all it takes. Take it baby steps, little by little. If you don't work in the ICU as a nurse aide, make some baby steps there, okay? Start putting start trying to talk to different managers, start trying to look for job applications, start making little steps today. If you've not gained your shadow experience, start making some phone calls. Do this virtual simulation experience. There are little tiny things that you can take, and it doesn't have to be overwhelming. Don't compare yourself to someone else, and know that people are more apt to talk about all their wins than they are their failures, right? So you're going to hear all these stories. Oh, I got to shadow a CRNA today, and I got to talk to program director, and I think I'm a shoo-in, blah, blah. I mean, I don't know why people do that, but if it's happening and you're around people like that, just tune them out. Do your thing, and you're going to be okay. But just know that, you have to take baby steps. And I think I also have students who tell me, like, well, Jenny, so-and-so had a lower GPA, less ICU experience, a lower GRE, and they got in and I didn't. I don't understand. You're comparing. You are you who you are. You don't know, like you think you know, but you don't really know. And yes, some people may seem like they fly into CRNA school, but the reality is you don't know because people don't necessarily talk about it. Think about it. People hide the fact that they're pursuing CRNA for years. They hide it because they're fearful of letting their managers know. So you might not even know that John Doe has been pursuing CRNA for the last 5 years because they've never talked about it. And now they just got in. They just applied and got in. But you have no idea that they probably prepared for a long time to get to where they are. Some people are more vocal about it than others. So just don't compare yourself. Just know that your timeline is unique. You don't have to whip yourself into CRNA school in 6 months like some people do. It's okay if you take time to get married, pay down debt, work. Don't worry about, oh my gosh, if I don't go back now, then I'm not going to earn as much. And just you have your own timeline in mind. Like I know, like for me, I wanted to focus on getting married. Like I didn't want to go back to school and not be married. In fact, I told my now husband, I said, for every year you make me wait, and if you make me wait and I get into CRNA school and we're still not married, you're going to have to buy me a bigger rock. And so then he bought me a ring pretty quickly. So that was a threat, a bigger ring, or you do it now. But again, I knew wanted that time, and I wasn't going to whip myself into CRNA school. And I didn't want to. I wanted to take the time to kind of like get acclimated after nursing school and take time to like actually enjoy my life a little bit before I went right back to grad school. So, but yeah, my girlfriend got in 6 months, and was I jealous? Sure, I was jealous. I wanted the same thing she had, but I also knew that in due time I would get there too. And she ended up being a really great resource for me to fall back on when it came time to interview. She helped me a lot, which is also why I say to try to touch with a current student if you can. I also wanted to point out that CRNA School Prep Academy is unique in the fact that we have expert contributor Richard Wilson. He's my friend. He's amazing. He's been a program or assistant program director now for 12 years. He does group mock interview coaching. He does guided Q&A sessions. We're actually getting ready to schedule out a live essay critique. And so he's going to take an essay. We're going to edit it live in real time so you guys can kind of see how he does it, and he can give this real feedback in real time so you guys can help give you ideas on when you're writing your own essay. I know a lot of people struggle with like writer's block when it comes to doing their school essays. So we do things like that. We cover, break down the GPA in detail. We just did transcripts, broke down, taking extra courses and what courses you should take versus not take. And he also is in our community forum and social wall, and he helps answer your questions. He's amazing. And again, CRNA School Prep Academy is able and fortunate enough to be able to have him as our expert contributor. So I hope you guys enjoyed this live today. Go ahead and go over to CRNAschoolprepacademy.com to join today. During CRNA week, we are giving away a free sticker pack. It's 5 stickers. If you have not seen the post, we have a Show Me Your Madeline Patty sticker, a Ketafall sticker. We have a I'm So Bougie sticker. We have an anesthesia gas machine sticker, and an SRNA sticker as far as the sticker pack goes. Just something fun, and you don't have to gain acceptance in the school to have fun with these stickers. Just put them on your laptop or your coffee mug as a reminder to what you're working towards. That was my goal with developing these stickers. I want something fun for you to look at and say, yeah, I'm going to be an SRNA. Cool, I got this. Or, I don't know what Ketafall is now, but I'm excited to learn what Ketafall means. Or I'm so bougie because I'm going to be putting that bougie down someone someday. I don't know. I just want it to be fun, lighthearted. And so again, if you join CRNA School Prep Academy for CRNA week, you're going to get a sticker pack to enjoy. I hope to see you guys in there, and wish you guys all the best. I'm having fun with these little buttons over here in the corner. I forgot what this last and final thing was. Turn my head into my logo. All right, you guys have a good rest of your day, and I will see you tomorrow.